Well, with the new year in full swing, many women have decided that this is the year to get pregnant. But is your body healthy and ready to go? Well, Dr. Roz is here with some tips to get you prepared if that is your goal, especially for your family. And then we have a special little visitor today. Dr. Roz, who do we have here?
This is baby Harper.
Hello, baby Harper. Welcome to Living Dayton. Now, how old is baby Harper?
She's 3 months old.
Something special about her. You have a very a special bond, if you will. Tell me about that.
Well, I delivered baby Harper and her two older brothers.
Oh, how cute is that? Well, we are so happy to have both of you on. You and I were talking a little bit backstage about this, that, you know, resolution goals are typically, like we talked about earlier in the show, getting healthy or maybe changing up your apartment or whatever the case may be, but some is to prepare for having a child.
Yes, yes. So a lot may want to have a new baby for 2015, and so there's some things that you should do to get yourself ready for bringing a new baby into your life and to everyone else's life. It's
a huge deal to bring another life, and what a joy it must be too. So we wanted to dive right in, because maybe if you're at home and you're thinking that this is your year, you know, you want to have a child. There are a few tips that Dr. Roz has for you, so I want you to listen very closely. The first one, it can be a tough one, which is avoid alcohol and smoking.
Yes. And so the thing about fetal alcohol syndrome, we don't know exactly how much alcohol it takes to get that diagnosis for your baby.
Yeah.
So the recommendation is don't consume any.
Right. That's right.
Don't consume any.
Baby Harper thinks the exact same thing, as you can see there. So, of course, try to avoid alcohol and smoking at any rate, too. The second one, too, has something to do with folic acid.
Folic acid is so critical, and it's something that we may not get sufficient amounts in our diets. And so prior to conception is taking adequate amount of folic acid in, and that's one of the key things that's located in all prenatal vitamins. And what it does is helps prevent neural tube defects, and it's so important to take that prior to getting pregnant, so that because when a woman finds out she's pregnant, the neural tube has already started to form.
Let me ask you back up real quick. Folic acid, what is that?
It is one of the B vitamins.
One of the B vitamins.
Yeah,
so it's very simple to take. You can find that supplement just about anywhere.
Absolutely. And it's in all prenatal vitamins. That's why we recommend taking prenatal vitamins prior to when you're thinking about getting pregnant.
Yeah.
Start it.
Definitely start that. Okay. The next one, too, be up to date with your vaccine. Something you don't think about, but it is something you need to take care of.
It is important, as well as getting the flu shot even while you're pregnant. Any trimester in your pregnancy, the flu shots are recommended.
Okay.
And so doing that, and that is the shot, not the nasal form of that, because that's a live virus. You want to make sure that it's inactive.
Okay.
And so
very important there. Make sure it's inactive there. Healthy diet. You got to have that.
Absolutely. So when these little babies are born, they're sterile pretty much. You know, their immune system is not very well developed. So when mom takes that prior to or while she's carrying the baby, it helps prepare the baby to ward off any diseases that's coming. And some key things to take: probiotics, putting good bacteria in your gut, fermented foods, and no pesticides in your foods, and organic if you can.
Avoid pesticides if you can do that too. And last but certainly not least, and this is one that I didn't think, and maybe this will surprise you too, but a healthy weight. You want to make sure you have a healthy weight. Is there a healthy weight to make sure you have before you get pregnant?
Well, believe it or not, it is. Obesity, it puts you at risk for preterm labor, something called preeclampsia that may result in an early delivery, and diabetes. You know, you definitely want to make sure you have good blood sugar levels, your hemoglobin A1C, because when it's elevated, that also puts your baby at risk for birth defects.
So you don't want to do all of those, obviously. If you can do anything to prevent that, definitely do so. Of course, you can find more information on this at drrozmd.com. And then Harper, of course, we appreciate you. Can I hold Harper? I want to see how Harper responds to me or not here. Hello, baby Harper. It's nice to meet you. My name is Sean. Am I doing this right? This is how you hold babies?
No.
Oh.
Just a little contact.
Okay. Let me see.
It won't be skin to skin, but a little. Yeah. They like.
Baby Harper, you are just the cutest little thing ever. If this is your plan and you want to start a new family, or perhaps add another addition like baby Harper here, these tips were great to have. drrozmd.com, of course. And then you said / healthy baby. There you go. Thanks so much.